Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to the presentation on managing chest discomfort during dental procedures. You know that ensuring patient safety and providing appropriate care is crucial. We will discuss the protocol to follow when a patient experiences symptoms related to chest discomfort. Identification of common causes of chest discomfort are very important. This box shows the common and uncommon causes of chest pain. Cardiac ischemia presents a squeezing pain and heaviness radiating to the left shoulder and arm. Gastric reflux improves with sitting up and antacids. Costochondritis varies with respiration and manual pressure. Anxiety can mimic heart issues but requires monitoring devices for differentiation. This box shows the clinical characteristics of chest discomfort. Stop all dental procedures immediately if ischemia is suspected. Ensure semi-reclined posture. Reassure and keep the patient calm. Obtain vital sign and start oxygen. Administer nitroglycerin sublingually at 0.4 milligram, repeating every 5 minutes up to 3 doses, ensuring systolic blood pressure greater than 90. This is the flow chart showing the management of patient having chest discomfort while undergoing dental surgery, and here is the initial management. The steps are shown here for initial management of the suspected ischemia. After the first nitroglycerin dose, monitor the patient. If discomfort is relieved, assume angina, taper oxygen, and modify treatment plans. The response to the first dose of the nitroglycerin is shown here in the flow chart. If discomfort persists after first dose of nitroglycerin, give a second dose, monitor vital signs, and call medical help. Response to the first dose of nitroglycerin shown here in the flow chart when the discomfort continues 3 minutes after the dose of nitroglycerin. Discharge the patient with future surgery plans if vital signs are stable and discomfort is relieved. This step ensures that any underlying cardiac issues are addressed and managed appropriately. The response to the second dose of nitroglycerin is shown here in the flow chart when the discomfort is relieved. If the discomfort continues for 3 minutes after administering the second dose of nitroglycerin, it is crucial to proceed with the third dose. Continue to monitor the patient's vital signs closely to observe any changes or deterioration in their condition. It is important to have someone on the hand to summon the medical assistant immediately. The response to the second dose of the nitroglycerin is shown here in the flow chart, and discomfort continues 3 minutes after second dose. Now come to the response to the third dose of nitroglycerin. If the discomfort is relieved after the third dose of nitroglycerin, the patient should be referred for a thorough medical evaluation before any further dental care is administered. Suspect myocardial infarction if discomfort persists after the third nitroglycerin dose. The response of the third dose of the nitroglycerin is shown here. In case the discomfort is continues 3 minutes after the third dose. Administer aspirin, start an IV with crystallized solution. If severe discomfort, then consider morphine. Call emergency services for irregular pulse or low BP. If possible, initiate venous access and slow IV drip. Prepare the patient for emergency transport while providing basic life support if needed. Transport is necessary for irregular pulse, low blood pressure, or persistent discomfort not relieved after 20 minutes. In suspected myocardial infarction, initiate BLS, administer aspirin and morphine. Prepare for hospital transport for advanced care. Now, quickly recap the important points to remember. First is the identification of the cause of the discomfort. Cardiac ischemia, squeezing sensation, heaviness radiating to the left shoulder and arm, gastric reflux improves with sitting up and acids. Costochondritis varies with the respiration affected by manual pressure. Anxiety differentiation requires monitoring devices. Managing steps are stop dental care immediately, administer oxygen and nitroglycerin 0.4 milligrams sublingually up to 3 doses. Monitor vital signs and reassure the patient. Discharge if stable or transfer to hospital if serious symptoms persist. Emergency transfers indicator are irregular, rapid or weak pulse, blood pressure below baseline. Chest discomfort unrelieved after 20 minutes of therapy, administer aspirin 325 milligram chewed and morphine 4 to 6 milligram if needed. Make arrangements for immediate hospital transfer for advanced treatments like thrombolysis, angioplasty, or bypass surgery. In conclusion, rapidly identifying and managing chest discomfort is crucial. Understanding the different causes to ensure patient safety, be prepared to stop procedures and provide emergency care if needed, administer nitroglycerin and oxygen and monitor vital signs, adjust treatment based on patient response, and be ready for emergency interventions and patient transport to hospital. Thank you. Wish you best of luck.